I'd like to extend a huge thank you for everybody coming and spending a Friday evening with me to talk about one of my passions, which is helping people. I'd like to give you just a quick introduction of who I am. My name is Kevin Lucas, and I've been practicing the wealth method of structural integration for 12 years, as well as teaching for the last 12 years. I started off as a massage therapist, and upon finishing my massage program, we transitioned into my structural integration training and have been going strong with that ever since. It's a huge passion of mine to share this information. My specialty, my clinic, I'm the owner of Balanced Life Center, which is a collaborative care wellness clinic where we have acupuncture, massage therapy, structural integration, dietary information, and it's a phenomenal way to be able to offer people an insight on what's going on. As many of you guys know, as you're all in the wellness field as massage therapists, that people are having a hard time, and especially with chronic pain, we're seeing people taking so many steps to try to help themselves, but still struggling with not getting better for the long term. So my specialty with patients are people who ran the gamut. They've had chiropractic care, physical therapy, they've had surgery, they've been on medications. Oftentimes they've had a great amount of massage therapy to be left not fully satisfied with where they're at in regards to their health improving. I specialize in dealing with neurological disorders such as dystonia, post-polio, Parkinson's, and what we find is that with the method that we utilize with our patients, people who've been struggling with chronic pain for years, decades, oftentimes, are able to get a very quick improvement in a very short duration of time, especially with the technique and the method that we're going to talk about tonight. The next thing that I would like to do is I would like to start off with some recognition. The biggest thing in acknowledging our ability to be able to be with people and be in relationship with people is recognizing those relationships. And we, as massage therapists, hold very special relationships with our patients. Think about it. The person going to the doctor that spends 5 minutes with their doctor, if they're lucky, people seeing even chiropractors oftentimes, which is an amazing process to the wellness toolbox. They don't get as much time with them as we do. We're spending an hour once a week, sometimes 2 or 3 times a week for, we have a lot of patients who've been receiving massage therapy for years. So we get to hold a very special relationship with our patients and our clients. So I want to thank you guys for being here. It's a Friday evening. You guys could be out on the town having a great night and having a good time. And you've chosen to take some time to spend with me this evening talking about the world of massage therapy and how we can better help our patients. So congratulations to you. One of my teachers consistently says, successful people are willing to do the things that the other guys and gals are not. And the fact that you guys are here with me tonight, making those steps in the right direction. The other piece that I would like to give huge recognition to is my beautiful bride. Cassandra is the one that does all the behind-the-scenes work. I get to do the fun part of getting to talk with you guys, my students, as well as working with my patients, and she does everything else. She's the webmaster, the technical guru, and I just want to thank her for allowing me to be able to live my passion. So recognition aside, what are we going to talk about tonight? The technique that we're going to talk about, or the concept that we're going to talk about, is where it is, it isn't. And what does that mean? I want you to take out a pen and paper. Hopefully you guys are obviously by your computers, and you have some writing utensils, because I'm going to want you to take notes tonight. There's going to be some very valuable nuggets of information. You're going to be able to watch this recording again if you choose to on the website, but there's something special to writing notes and taking notes. We on average use 8,000 neural pathways when we're writing something down, and that allows our brain to be able to assimilate and absorb the information in a very different way than if we're just listening or if we're typing notes on a computer. So what I want you to write down right now is, what are the most common areas of pain that you experience or your patients experience when they come to you and they're seeking therapy? Obviously, we have a huge gamut, huge area that people can choose, but there's some consistent spots that people experience chronic pain. They're stretching, they're walking, they're working out, they're changing their diets, and then they're still struggling. So as you write that down, if you think about all of the patients you see in a day, in a week, in a month, What are the most common areas that those patients tell you that they're having the hardest time? So many of my patients, we see chronic neck pain, chronic back pain in the thoracic area, low back pain, as well as hip pain. Knee pain and ankle pain definitely kind of jump in there, but the upper cervical region and the lumbar region tends to be the areas where we see a very significant amount of chronic pain. When people are talking about the thoracic area, oftentimes they make note that it kind of comes and goes throughout the day depending on how stressed they are, what their workload is. But when we're talking about the cervical spine and the lumbar spine, it's very common that those are areas that kind of stay with us all day long. When they go to bed, they still notice their low back, or they still notice the neck when they're sleeping and when they wake up. So what are those chronic areas of pain that your clients experience? So that being said, the next question that I want to ask you is, what is the difference between pain and symptoms? This is going to be a big key that we're going to need to talk about tonight, and this is something that we should all be talking with our patients about, because quite frankly, most of our patients don't really have a solid understanding of how their bodies work. And so what we say, it's very similar to automobiles. Most of us, we can take the key, we can put it in the ignition, start the car, and we can drive the car, but how many of us really know the intricacies of what's happening within our vehicle? And what we find is that people who know a little bit, they can change the tires, they can add air, they can add oil, they can change their own oil. And that would be someone who's exercising, someone who's eating okay. But when it comes to dealing with chronic long-term pain, what we find is that very few people really have a good understanding of what's actually going on in their body. And so they come to us as the therapists looking for help, and they say, oh, I'm hurting, my shoulder's hurting, my low back is hurting, my hips are hurting. And what they ask oftentimes is, can you please work on my shoulder? Can you work on my hip? Can you work on the area that's hurting? Now, there's some benefit to this, but is the patient then, after your treatment, experiencing long-term consistent relief from what you just did, or within 2 or 3 days are they right back to having the same problem again, and then the next month, and then the next year, and then we're going on to decades? And as many, in the poll that we did earlier, we saw we had quite a few practitioners that have been practicing for a good 8 to 20 years. So you guys know, you've seen people that have been dealing with pain issues for a very, very, very long time. So what is happening with their pain versus their symptoms? Can people differentiate? I'm feeling a little achy, or I'm feeling a burning sensation. Oftentimes people have a hard time even quantifying what it is that they're experiencing. They say, oh, my shoulder hurts. Now when we ask them where in their shoulder, they say, oh, just my shoulder, my shoulder. Is it the clavicle? Is it the sternum? Is it the scapula? Is it the glenohumeral joint? Is it the attachment of the deltoid? Is it the rotator cuff? Oftentimes people get very misguided when it comes to what is actually going on and where they're hurting. So then they go and they seek therapy, and they can get good therapy, but the next week they could be right back to square one. So we really need to start understanding the concept and the difference of where the pain is, what the symptoms are, and where the pain and the symptoms are actually coming from. And that's what we're going to talk about. Where it is, it isn't. So when a patient comes to you and says, my shoulders are hurting, my back is hurting, my neck is hurting, does that mean that that is the problem, or does that mean that that's the symptom? Here's an indicator for you. If they're coming back to you week after week after week for months and years and decades, and you've been working on where they say they're experiencing pain, which is absolute truth, right? We're not going to tell them that they're not hurting there. What we find is that if you're working the right areas, why is it that they're having the same problems over and over and over? They feel better for a couple of days, maybe even a couple of weeks, but they're right back to square one. A common statement that we hear in our clinic, especially with new patients, is, oh, I was seeing a massage therapist, and if I didn't get my massage on Friday, I was going to be miserable for the whole weekend, and if it wasn't for my massage therapist, I'm going to have a hard time. Or if I don't get my chiropractic adjustment, I'm not going to be able to have a good week at all. And what that's doing is that's taking all of the accountability for what they have going on in their bodies and putting that responsibility on somebody else. And what we're finding is that as a result of that, we're dealing with a very significant amount of chronic pain that just isn't going away, or it's just not being managed. If I'm watering a plant and I'm trying to take care of a plant and it needs a certain thing, such as water and sunshine, but I put in Red Bull, I put in tea, I put in Coke, I put in all of these other things, Pepsi and Mountain Dew, and it's dying, I'm not going to question what am I doing wrong. I'm going to know, oh, I'm putting things in the plant that aren't supposed to be there. People oftentimes don't apply those same concepts to their bodies. So they're going and they're getting, good therapy, but they're not getting better, and they don't ask the question, man, what's going on? Why is it that I'm not seeing consistent improvements, and why isn't it that improvement isn't holding? Really good chiropractors, really good PTs and massage therapists will be the first one that will say things aren't really changing, and I think we need to find another avenue. And that's why having a good referral source helps. But again, where is the pain coming from, and what are the problems? So I want you to think about when you're working with your patients, do your patients have the understanding of the difference between their symptoms and their pain? And then the next step is that what is the problem? So when my patients come to me and they say, my shoulder hurts, my back hurts, we take that into consideration, but for me, that's not the underlying area that I'm necessarily going to work. If their shoulders are hurting, we understand that they're experiencing some discomfort there, but there's some very phenomenal research that's coming into play over the last 2 or 3 years, particularly the last year, regarding chronic pain. This is something we're seeing very consistently, where a person will go to the doctor, they'll send them in for an X-ray or an MRI, and they'll get the MRI back, and lo and behold, the MRI will show that there's nothing there. The tissue, there's no tissue trauma, there's no tear, there's no lesions. Maybe there's a little bit of scar tissue, but in the big picture, what the patient is reporting as severe, debilitating pain doesn't correspond to what the image shows, which is that the tissues are actually really not that damaged at all, and they've healed if there has been an injury, or they don't really understand what's going on from the patient's perspective because the imaging shows there's nothing there. So that's another indication that where it is, it isn't. The person, again, is experiencing the pain in a specific spot, but we're really not seeing any long-term change. And our goal should be is that if we're working with our patients, we should be able to have them receive a treatment, and that treatment should be able to hold for a significant amount of time. And if it doesn't, that's an indicator that what we're doing maybe either isn't the right tool, and or something is happening in between the sessions that the patients are doing that's not allowing that to hold. So, so the video, there's a question, the video isn't working well. Can you state what is not working well in the video? Christine? Choppy. Is anyone else experiencing those same issues? Okay, so other people are reporting that they're not having the same problem. So my technical advisor is saying that you should log out and log back in and see if that addresses the issues. So, when we're close, it's better. Okay, so I'll scooch up a little bit and see if that makes a little bit of a difference. And we'll go from there and see if that helps with the choppiness.